This is what passes for a social life now for Britain's teenagers. With schools shut to most children, hanging out with friends is a strictly online affair.
I'm just missing the engaging that you can do in class.
It was quite daunting because I was scared that I was losing everyone and losing touch with everyone.
As Conservative MPs clamour for a plan for schools to reopen, teenagers across the country have been sharing the terrible impact of the pandemic on their mental health. 15-year-old Blessing already suffered from anxiety pre-COVID. Now, with her GCSEs in limbo, the uncertainty and fear is taking its toll.
Seeing people lose their family members or not be able to go and see, their parents or their grandparents, in case they might risk, spreading it, it's kind of hard because, it doesn't feel right. It's not everyday living.
She's not alone. In her annual report on the state of children's mental health services in England, to be published later this week, the Children's Commissioner Anne Longfield lays bare the scale of the problem and the inadequacy of government help. She says a cocktail of risks and stresses appears to have taken a very heavy toll on some children, and a staggering 1 in 6 children now have a probable mental health condition. And she reveals a system without the necessary capacity or flexibility to respond to such seismic events in the lives of children. Already in the year to March 2020, largely before COVID hit, 538,564 children were referred for help, an increase of 35% year on year. But NHS clinical commissioning groups spent 13 times more on adult mental health than children's, which accounted for less than 1% of their budget last year. Blessing has had help from a youth charity, Power too, but she says her generation feels forgotten by the government.
I feel like we've been put on a back seat and told that, we're not that important, when I feel like the government should have really started with the young people, because the elderly, they've, experienced their lives, they've gone to school, they've done their exams and they've had their jobs. But young people, it's our time.
And she has a message for the Education Secretary.
You need to step up, you need to give a clear and concise explanation to teachers on what you're planning to do.
Paediatricians are seriously concerned about teenagers, but younger children too, even spotting extreme anxiety in children as young as 4 or 5.
We're seeing anxiety, we're seeing depression, even in really young children. We're seeing people, babies, children who are being kept at home, not seeing anyone outside of their families, not seeing friends. And, I always say children need children. And what we're seeing in this stage of the third lockdown is babies and children only being able to see their own parents and people within their household. It's really worrying, and it's causing great damage.
Back on Zoom, Blessing and her friends trade hopes for the future.
I can't wait to go back to having assemblies. I can't wait to go back to having award ceremonies. I can't wait to go back to, just eating lunch in the canteen or in a diner or something.
The Children's Commissioner for England is leaving her post within weeks. Her parting shot? A warning in her report that the government has always lacked ambition on child mental health, and that it shouldn't take another decade to do the right thing for an entire generation.